Missouri lawmakers will consider a bill allowing terminally ill patients to end their life with the help of a doctor. Part of the legislation's title is Death with Dignity. Similar policies are already in place in 10 states and in Washington, D.C. Joe McLean shares the story of one family who'd recently dealt with this decision.
This bill is called the Marion Teitelbaum Death with Dignity Act. Its namesake was a St. Louis area woman who suffered from ALS. She and her family wanted to end her life, but that was not an option in Missouri.
We contacted hospice, which basically does it, and moved to Denver. Went to Denver. I rented 2 apartments juxtaposed to each other, so the whole family could be there.
It was an impossible decision, but as Teitelbaum's wife, Marilyn, was in the final stages of her battle with ALS last year, they made the decision to establish residency in Colorado to be eligible for medical assistance in dying, or MAID services, which are legal in that state. Teitelbaum describes his late wife's final moments as a peaceful experience for the family.
She asked that my nephew, who plays the guitar, play Amazing Grace, and she drank the fluid that ends her life, and it just was peaceful and gracious, and she left the family on its feet.
I think the biggest hurdle we have as Americans is talking about it right now, is hearing a diagnosis and accepting it.
Lauren Ponder works as an end-of-life counselor, helping families navigate the difficult process of losing a member, from identifying palliative or hospice care, arranging services, and even just acceptance of what is happening.
I find that most people probably wait a little too long to accept that diagnosis, to lean in to that.
Opponents to this policy argue that allowing terminally ill patients to end their life could be a slippery slope to allowing healthy patients to do so as well. Others contend the practice devalues human life. But for Teitelbaum, death is a universal part of life, and dragging out a painful one where there's no hope of recovery hurts both the patient and their family.
What it does is it negatively impacts the memories that one has of that person that they love.
Missouri lawmakers reconvene for the legislative session on January 3rd. In Jefferson City, Joe McLean, KY3 News.